With the spotlight increasingly being placed on mental health, it's useful to understand the resources used to address such challenges. Music therapy is one such tool available in Trinidad and Tobago. Meet Mr. Jamal Glynn, Trinbagonian professional music therapist with a unique specialization.
Hi, my name is Jamal Glynn. I'm a music therapist, and I've been working for a number of years. Music therapy is a clinical practice, evidence-based. It's really non-verbal communication, and we get an opportunity to help people have a positive therapeutic relationship. Music therapy also uses the quality of music, the elements of music, for example, rhythm, pitch, tonality, to help non-verbal communication. My dad, he passed away from prostate cancer, and going to the hospital and seeing that there weren't anything available for the better quality of life for people who come in, like end-of-life care, for example. So I was really thinking maybe I could get into that, because some years before that I was exposed to music in hospitals, just performing in hospitals, and this was in the UK. And interestingly, in Trinidad, I was able to go through the ranks of a steel pan player, started off in school and ended up reached the National Steel Orchestra, and I wanted to do something a bit different. So the university undergrad program had a course available to us, introductory to music therapy. And I thought, well, yes, I could explore this avenue as a steel pan player. And I was lucky, I was fortunate enough to get a developmental needs award to go study in the UK. Yeah. I just want to be different, and music therapy seemed to be a challenge.
In Trinidad and Tobago, music therapy is available both in the private and public sectors.
I'm the only music therapist in the public sector thus far, and I work under the umbrella of Northwest Regional Health Authority.
Mr. Glynn explained that music therapy does not take place in isolation.
So I'm part of a team, and in the team we will find social workers, psychiatric social workers, because I work in the psychiatric setting. We'll have mental health officers. We also have psychologists, and just recently care workers. And sometimes we all sit and we talk about a particular case. Well, music therapy is a referral system, and based on the referral, the client comes into the room and we try to create a safe and trusting environment for them. So we have like a special space with a sign on the door to like do not disturb, as the case might be. So there's an assessment process in the session where we think about the relationship, and it may not be the same goals for everyone. So we tailor the session to meet their needs. So we use the instruments to help them communicate. Because it's a process, initially there's a discussion that takes place with a psychiatrist or a psychologist. And most times we describe that as psychotherapy. And based on that initial assessment, it may be really difficult for the client to engage verbally. So they think, all right, this person probably has a musical background, or music therapy could perhaps possibly benefit this client. And that's when the referral comes to me. And based on that connection, I'm able to move forward with the client, but on the premise that I regularly consult with the consultant, psychiatrist, or psychologist.
So, what do therapy sessions involve? Are clients expected to play instruments or listen to music?
Yes. So we do free improvisation, which is really similar to free floating people who do art, visual art, or people who do talk therapy, for example. They call it free association. And from that, we get an opportunity to make sense, interpret, talk about what's going on.
On the topic of instruments, Jamal Glynn is largely distinguished from his international counterparts because of his use of the steel pan in therapy.
I play steel pan. That's my main instrument. That's my principal instrument. And I'm really passionate about music therapy research and the use of the steel pan in a Caribbean context. Pan in music therapy is fairly new. So there are some examples of people using the instrument in special needs homes or schools or elderly homes, as the case might be. But there isn't enough documented evidence. The primary instruments for many music therapists are conventional instruments. So bringing the pan is something different, coming from a different spectrum. So our instrument is sort of celebrated in a different way, where there's a sort of like freeness, a sort of aspect that could now be used to fill the gap in terms of music therapy research.
Apart from the wonder of music making and the connection that locals have with the steel pan, what is it that encourages clients to stick with therapy? Well, with the intervention of music therapy, clients often experience meaningful breakthroughs.
So it's not so much enjoyment per se, it's being able to convey something, convey an emotion they're not able to anywhere else. So sometimes the sessions may not only be laughter, sometimes there can be tears as well. Really, really difficult moments. And the work is really intense. So I guess just by being able to have that shared experience is motivation within itself. Because sometimes if you think about a scenario where a little boy might be really upset for some reason at home, and the parent doesn't understand, and he doesn't understand how to convey or express this, then he withdraws himself. So that withdrawal through therapy sessions could change into something more meaningful, and they don't feel so isolated anymore. One success story in music therapy for me is having seen a young man for over 4 years. He really struggled with intellectual challenges. That was like part of the referral, and for me it was really interesting to see him able to make full sentences, because in the beginning he wasn't able to do that. Just to help him move from that impairment into something more fluid was really, is a success story. In the Caribbean, we struggle with a poor self-image. And I remember Pat Bishop said that when we did a song, I played Pan for Phase 2, and she was saying, we don't like ourselves. And it's just so true. You know, when we look at each other, we don't see strength, we don't see positivity. So one thing music therapy provides is that opportunity to create positive thinking, help people have a positive outlook of themselves and not necessarily get caught up with the confusion that's outside there.
With so many specialists working to maintain and improve the mental health and wellness of persons in Trinidad and Tobago, there is clearly a need for this type of work. And, despite hurdles in the field, both clients and professionals note the rewards.
I enjoy helping people move from point A to point B. Each time I see a particular client, I see incremental changes. And sometimes these changes are not noticeable by the parent, caregivers, or even other professionals. So for me, I get to see these changes from week to week. And that is a big reward in itself. For me, it's like motivation, and they come. So they are motivated to come back to sessions because they get that positive reaffirmation, as the case might be. Because most of the conflict or confusion they're having, they weren't able to express that anywhere else. So for example, I've seen cases where they were nonverbal, for example, and to actually hear them say they don't want to come back to music therapy after 4 or 5 years. That's like a amazing step to actually, experience that. My biggest challenge being a music therapist in Trinidad is the lack of understanding of what I do. So I take the opportunities to try and do information sessions and build awareness for others to really appreciate and understand that a gap is being filled. One thing I would like to share is I believe music therapy is not something that should be considered an activity or a hobby. It's really a specialized field, and it requires specialist training, because sometimes people may think, all right, I'm a psychologist, but I'm a really good musician, and they think it's a marriage of the two, but it's not. It's actually a specific discipline. And I just really want to ensure that that message is conveyed.
Mr. Glynn sought to further clarify some misconceptions about music therapy.
I think a big part of the challenge is the whole idea of the culture, Trinidad culture. So for example, many people would go to class, for example, crochet class, or they might do floral arranging class, or they might go to gym class, as the case might be. So just to think about what a session is really difficult, and to think about therapy. So many professionals struggle with the word therapy compared to counseling or counselors. It's really two different things.
After grasping the dynamics of music therapy, persons considering this profession are advised to sharpen their skills as musicians, utilize available avenues for training, and be guided by their passion for helping others.
I think the first thing is to hold on to your dream, because some people may think they can help someone. So sometimes we see the personality in someone whereby they are really good listeners, for example. And I think there's a good quality, somebody who can listen and really understand and connect. Internationally, music therapy is offered on a master's level. Most times, there are some universities who offer undergrad, so there's some sort of credential for that. But in most places now, they really require persons to have a master's certificate or degree to practice in the UK, in Europe, Canada, some states in the United States of America. What I would like to see as something, as a sort of improvement in the music therapy landscape is a music therapy training. So we have a 3-month course available in Trinidad now. There's a need for a 2-year program, a proper course. The real motivation in music therapy is the ability to help others move from point A to point B. So there's a need for that locally. Mental health in Trinidad could be our wealth.